epidemics detections and response. Learning objectives. By the end of this unit, the participants will be able to define malaria outbreak and epidemics, describe the purpose of malaria epidemic forecasting and early warning, explain basic principle of malaria epidemic detection and responses. Definition. Outbreak is an increase in the number of cases of a disease compared with the expected number. It lasts for a short period of time or occurs only in a limited area. Epidemic is an excess in the number of cases compared with the number expected. Epidemic is more general than an outbreak. The increase in the number of cases continues for longer and the cases are distributed across a wider area. Malaria epidemics is the occurrence in the number of malaria cases in the excess of what is expected in a specific place and a period of time. Sometimes it is hard to distinguish malaria epidemics from the usual seasonal upsurge of malaria cases. Malaria epidemics can be one of the most serious diseases. Continues. Epidemic could be an exaggerated seasonal or periodic increase of cases or explosive epidemics. An acceleration of a secular upward trend which could be related to neglected breakdown of control measures. In non-endemic areas, any transmission, even few confirmed cases, can be considered as an epidemic. Rapid increases in the number of cases should be treated as potentially dangerous epidemic, even if the number is within the expected level for a specific area and a time period. Overview of malaria epidemics in Ethiopia. A devastating malaria epidemic responsible for 3 million cases and 150,000 deaths. Since 1958, major epidemics of malaria have been occurred at approximately 5 to 80 years interval. In 1998, a widespread severe malaria epidemic occurred in most highlands as well as lowland areas of the country. In 2003, widespread epidemic of malaria has occurred in highland and highland fringe areas up to 2,300 meters. Causes of epidemics. Malaria epidemics can occur because of variability or change in the rate of infection and population immunity. Epidemics can occur in places where there is low and unstable malaria transmission and where people have low or no immunity. Epidemics can occur in high transmission areas if there is deterioration of the health system, interruption of anti-malarial measures, migration of non-immune individuals in search of work. Malaria epidemics. Epidemic precipitating factors. Unusual local weather phenomena and activities resulting in environmental modifications that increase mosquito population. Increase the vulnerability of population due to famine and malnutrition. Underutilization of anti-malaria interventions. Introduction of potent vectors. Resistance to anti-malaria medication and or insecticide used for vector control. Malaria epidemic forecasting and prevention. Predicting malaria epidemics from early warning sign and could be possible by regular monitoring of epidemic precipitating factors. The occurrence of epidemic can be prevented by strengthening the health promotion activity, implementing effective preventive measures, strengthening surveillance and case detection system, strengthening anti-malaria community stock management system. Epidemic forecasting and early warning. 1. Epidemic forecasting refers to prediction and based on seasonal climatological forecasts that are available within 2 to 4 months in advance. FEM and other sectors, DPPC are responsible for achieving as well as monitoring this type of data. Early warning. Early warning is a continuum of forecasting referring to more direct indicator of an impending epidemic. Meteorological data such as the amount of rainfall in a local area, of flooding, an increase in environmental temperature, etc. Entomological data such as larval and adult mosquito density. Morbidity data increased the malaria case at OPD, IPD, inpatient, etc. Epidemic preparedness. Preparedness include trained human resource, diagnostics, and anti-malarial drugs, supplies, and insecticides. Plan of epidemic preparedness. Identify vulnerable groups based on stratification data. Have Kabbalah-based stratification to allow flexibility in taking more targeted and timely interventions. Epidemic preparedness. Identify Kabbalah at risk of malaria epidemics. Have quantitative and qualitative information of the Kabbalah, including village mapping of epidemic risk and the local knowledge of the area. Review previous epidemic records 5 to 10 years. Epidemic data. Information on local epidemic risk factors such as meteorological, if possible, environmental, social, and economic risk factors. Information on biological factors such as parasite and vector species involved in the area. Then regroup or stratify those identified village and population in their epidemics risks and further put them in sketch maps as a rule. In addition, 25% of the annual drug requirement should be kept as contingency. IRC and LLINS should be used in selected areas where substantial seasonal malaria transmission predictably occurs. IEC, PCC activities encouraging LLINS use, early treatment seeking and acceptance, as well as cooperation of IRC operation successful. Epidemic preparedness. All regional health bureaus in the World Health Office should plan, request, and budget the amount of contingent supplies required at each level. Should be part of the annual anti-malaria commodity microplan. All levels of public health system should report at least monthly to higher level the status of their inventories of critical supplies, well as expiry status. Epidemic detection and mitigation. Morbidity data monitoring. This data can be used for early detection of onset of epidemics only if data collection is complete, timely, or weekly reporting is appropriate. More representative analysis is prompt, and interpretation provides an accurate indication of unfolding epidemics. Method 1. Classic method. Use malaria surveillance monitoring chart. This is currently recommended and probably continue to be used for some time in areas of higher moderate transmission. Method 2. Cluster mapping will be applicable as malaria incidence and transmission in area falls to the low level. This method will improve management of the relatively few clusters of malaria infections that remain within communities. Method 1. Malaria epidemic is defined as the occurrence in a health facility catchment area of case of an illness clearly in excess of normal expectancy. To establish threshold norm chart of any given year, a health facility past 5 year data should be compiled by week. A threshold is determined using the two largest members. Then current year data should be compared with the threshold. If an increase above the weekly threshold is observed, it implies that there may be an epidemic. Definition involves clear time, place, and person. For this, we need to know which health facility attachment or other defined area are affected, when, at what time period the epidemic has occurred, what is the normal expectancy of that area and the time period, what do we mean by case definition, how many of these, what proportion of tested cases have malaria by RDT or microscopy, what is regarded as excess, who has become ill. Health post or Kabbalah is the smallest administration unit. PHCU can use the disaggregated data by Kabbalah or health post. Time period. World Health Week. WHO week, Monday to Sunday. The threshold can be established option if you have previous 5-year data. Use the second largest number or third quartile. The norm chart of threshold. What is necessary to build malaria monitoring chart? Ready-made malaria monitoring chart. 5-year data of the Kabbalah or health center disaggregated catchment area. If there is no 5 years data, doubling of the last year's data. If there is no last year's data, use recent weeks collected data. Whereas should use the disaggregated data of the health post or Kabbalah and health center and draw their norm chart or threshold. Why do we need a threshold? It can be very difficult to distinguish an epidemic from a normal seasonal increase of case. Once it is apparent that the seasonal increase is much higher than the normal, the epidemic is well underway. How to calculate the threshold? The following tables give example how to tabulate data for establishing a threshold. Key principle of epidemic detection and action, defining epidemics according to the particular time period and area. The basic unit of a time is a week. Epidemics in method 1 is defined according to a weekly threshold, while method 2 use a time window of up to 4 weeks. In both cases, taking action to avert the epidemic should be as soon as it is detected. Key principles. Both methods use a combination of active surveillance and other containment action. LLIN use other vector control, requesting the supply and further support if need arises. Method 2 provides an evidence base for SCBCC effort and other sources focused on areas of the Kabbalah with the most intense recent malaria transmission. That means malaria microcluster with 1 kilometer. There is no need to wait for formal confirmation of an epidemic before starting active surveillance and containment actions. Epidemics which spread beyond the Kabbalah or world may need further support confirmation from zonal, regional, national level to provide additional source supplies. Can be confirmed by epidemic confirmation can be confirmed by RT or microscopy. Large epidemic will require plate slide for microscopic examination and analyzed by Federal Ministry of Health or EPHI experts. In certain cases, dried blood spots on filter paper may be collected or serological analysis. Initially, the most important information needed for an assessment will be how many suspected malaria case persons were documented within a specified time period, week, months, within a specific district or Kabbalah or place. How many of these suspected cases were tested by rectal microscopy? How many of the tested suspected cases were diagnosed as positive for malaria? How many laboratory confirmed malaria cases were PF or how many were PV? Analyze morbidity data by place, person, and time. Calculate CFR, fatality rate, or an increase suggested direct resistance, decline in quality of care. Estimate the burden of malaria case. Example, number of cases, percent of immediate visit, proportion of affected population. How many severe malaria cases, hospitalizations, and disease? Compare current malaria case with the previous year data. Is there adequate supply of RDTs, AL, chloroquine, quinine, rectal artesunate, IV artesunate, and other anti-malaria drugs and the supplies. List of person tested treated during mass presumptive fever treatment or mass fever testing and treatment must be reported. The following table may be used for recording MEPFT and or MEFTT, starting from one randomly selected household in highly affected part of the village. Take 20 house in sequence and fill in the following format. Response to malaria epidemics. Measure for control of malaria. Epidemics should be selected on the basis of epidemiological situation of the area, characteristics of the epidemics, availability of resources. Response to malaria. Mass fever testing and treatment. Test everyone with fever and treat those with confirmed malaria. These steps should be taken when sufficient RDT are in stock and as long as RDT positivity is less than 50% upon examination of 50 febrile patients. Treatment must be specific. Refer to RDT receiver to reduce waste of the most vital medication. AL since test negative patients do not need to take AL. Mass presumptive fever treatment upon examination of 50 febrile patients if RDT positive is greater than or equal to 50%, which switch to MEPFT. Treat all persons with fever presumptively. This should be done when stock RDT are low while waiting for supply. MEPFT indicates treatment with AL unless the cause of the epidemic is definitely confirmed to be PV vaccine, plasmodium vaccine only. Both MEPFT and MEPFT are most rational within malaria hotspot areas, that means household, especially within 500 meters of a cluster of known recent malaria transmission or cases, beginning with the nearest homes. Register must be kept of person actively